Thank you, Pandora. All right. As you guys know, we had a very, very extreme cold weather last week, but the topic that we have coming up is a very hot, sizzling topic, Vaccine 101. So we have Dr. Ian Glass here. Dr. Glass, are you able to, are you available, are you ready to speak? Just wanted to make sure.
I certainly am.
Awesome. All right. So Dr. Ian Glass graduated with cum laude distinction from Yale University. He obtained his medical degree from Case Western Reserve University School of Medicine and graduated with honors. He completed his internship and residency at the University of California, Los Angeles Medical Center, and is board certified in internal medicine. He also holds an MBA. Dr. Glass has over 25 years of experience in the healthcare industry. He has served with numerous healthcare systems in his career, including University Hospitals of Cleveland, Mount Sinai Hospital System, Cleveland Clinic, Community Health Systems, and HCA, and for the past 3 years with Houston Methodist as Chief Quality Officer at Houston Methodist Willowbrook Hospital. He is an adjunct assistant professor of medicine at Texas A&M University College of Medicine. Dr. Glass has been one of the Houston Methodist physician leaders leading the hospital's response to COVID-19. So thank you again, Dr. Glass, for joining us. The floor is yours, or the screen is yours.
All right. Well, thank you very, very much. And I hope all of you are well this morning and that you continue to stay well. So we're going to go over a few things. And if you have questions, feel free to send those out, and we'll be happy to try to answer all of that. So we're, and how am I going to advance this? Perfect. Okay, great. Okay, so we're going to talk about the vaccines and COVID. And the first thing I wanted to give all of you is that, and you may know this already, but anytime you're curious, you can go to the TMC, Texas Medical Center, COVID stats, and you go onto the Google it, and you'll find a whole host of different pieces of information. And just wanted to demonstrate to all of you, this is the weekly average of the daily new COVID-19 positive cases. And as you can see, over the course of December and January, there was a massive spike in the number of COVID cases here in Greater Houston. And thank goodness we are now seeing a diminution in these cases. And across the United States, the actual number of new COVID cases is falling by 2/3 compared to what it had been running in December and January. So that's the good news about it. You may also know the bad news, which is that over 500,000 people have lost their lives to COVID during this pandemic. And that has obviously torn apart families and communities and has had a markedly devastating effect on all of the United States and indeed all of the world. Let's see. Can we advance this again? Hold on 1 second here. Did you just hit this? Okay, good. All right. This slide shows the hospitalization rate, and as you can tell, again, mirrors what I was just saying, that we are seeing, thank goodness, a decrease in the number of patients who are hospitalized at the Texas Medical Center. But this is, again, through the entire greater Houston area. The number of hospitalized cases is decreasing significantly. So vaccines, this is the most wonderful thing that has been developed. The vaccines that we have currently are manufactured by Pfizer and Moderna, and they are what are called messenger RNA vaccines, and we can go over a little bit about that in a minute. But the daily vaccinations in the United States through the early part of February had reached 1.34 million shots a day. And actually, those statistics are now closer to 1.6 million people a day are getting vaccinated. You may also have heard that both the Moderna and the Pfizer vaccines are 2 doses. The Pfizer is given initially and then 21 days later. Moderna is given initially and then 28 days later. But there is increasing evidence that one single dose of the vaccines confers about 85% efficacy. And this is causing some people to think that do we really need 2 shots or not? But the way the studies were done originally, they were done with an initial dose and then a booster shot, and that gave 95% efficacy. So currently, the CDC has recommended that we maintain that type of schedule. Now, in the state of Texas, the entire state is covered by the Department of Health of the state of Texas, and they are the ones who decide how vaccine is allocated. And it's given according to whether or not there are vaccine hubs. Initially, there were 3. Now in our greater Houston area, there are 11, and also through the major medical centers as well. And the state has set up a tiering system. So initially, individuals who are initially over 65 years of age and people who have comorbidities such as diabetes, high blood pressure, heart disease, cancer, a variety of different disease entities, those individuals were the ones to receive the dosing most immediately, along with essential workers, the front line, because if you don't have your medical personnel vaccinated and they start to get sick, then who's going to take care of the sick patients? So we work off a tiering system, and this gives you some idea of how many doses are being given. And I'm sure, as you also know, you can look at your newscasts every evening, and you can see where the vaccine is going to be given, whether it's done at NRG, whether it's going to be given at other centers across the greater Houston area. So in week 8, Texas received 520,000 first doses of Pfizer and Moderna, and those were distributed, as I said, 13 in the Houston metropolitan area. And the state allocates all of these dosing amounts to the various hubs. And the purpose is to get as many eligible people vaccinated as soon as possible. And this is, as I was referring to you before, the vaccine tiering system, the high-risk people, the people who are essential workers, and then, and we're still in the phase 1. Phase 2 has not been invoked yet. So we're still in the process of getting the 1As and the 1Bs. And once we complete that, then we will start to move on to phase 2. And that will include teachers under the age of 65 and school staff, although school nurses were moved up into the phase 1 area as such. So more to come as we continue to get more doses of vaccine. So how does this vaccine work? Here's a slide that talks about what goes on. But basically, let me just try to explain this to you as simply as I can. Viruses are made up of, in this case, 16 genes of messenger of RNA. And RNA is a little bit different than DNA. All of us have DNA in the nucleus, in the center part of our cells. And it is that material, that genetic material, that half of which you got from your father and half of which you got from your mother, that determines who you are. In a virus, viruses work only in living cells. They themselves cannot recreate themselves outside of a living host. And viruses, by and large, are what are called RNA. They're slightly different chemical material. However, they both work the same way, which is that they hijack the mechanisms in the cell that cause for replication of genetic material. And in this case, what we do is, and what the scientists do, is they take a piece of the virus, not the whole virus at all, but just the piece of the genetic material that codes for the spike on the surface of the cell. You've seen pictures of this sphere. If you look at the bottom down below, there's a sphere, and there are these little protrusions that come out of the surface of the virus. These protrusions, or spike proteins, are what enable the virus to latch on to receptors on our cells, especially the receptors that are in our what's called the mucosal barriers, like your nose, your throat, your lungs, and your GI tract. And those abilities to latch on allow the virus to enter the cell, where the virus then goes ahead and replicates itself and then breaks out. In this case, what we do is we give in the vaccine just a little tiny piece of the RNA, not the whole thing. So you can never, you're not getting the virus, you're just getting the genetic material. And then it enters your cells, and your cells make, if you look at the thing that says learn, it makes these Ys, and those represent antibodies. And it's those antibodies that hook up to the spike protrusions on the virus's surface and neutralize it. They cause the surface of the, when they latch on, they actually cause the virus to explode and die. The other thing is that you see that on that learn, you'll see these little circles with a T on it. And the other thing that the vaccine does is the same protein causes your T cells, which are the like little Pac-Men. They stay with you forever. They are the memory cells that help you fight infection, just like if you had measles or mumps or chicken pox or any other kind of virus. You have these memory cells which forever will help you to fight off the infection. And so the ability of your body to make cellular immunity will probably help us to give these the vaccines and not have to worry that we may not have to give it every year. We don't know what the answer to all that is yet. That's what is actively being studied by scientists around the world. But the preliminary information that we have been able to obtain from the studies that have been completed show that the T cells are very robust in their development, and we are hopeful that that will mean that when you get the vaccine, you won't have to get it every year like the flu vaccine, but in point of fact, it will last much longer. But we don't know all of that for sure yet. So the questions are, is the vaccine safe? Absolutely. These are probably the safest vaccines that have ever been developed. One of the reasons is you're not getting the whole virus. You're only getting a tiny portion of the RNA, the software, so to speak, that codes for the protein on the surface of the virus. So they're very safe. Is it effective? Absolutely. The studies that initially were done showed 95% efficacy. That is the highest efficacy of any vaccines that have ever been developed in science. Are there issues with particular subgroups? It would only be individuals who have significant allergies to the point of what's called angioedema, where you get challenged with the protein, and then suddenly your lips swell, your body has what's called an anaphylactic reaction, and these have been incredibly rare. And so as you see, and I can demonstrate to you that the millions of people who have been vaccinated so far, the CDC has not reported individuals dying. So every day that another 1.6 million people get vaccinated, you're not seeing massive numbers of people dying of any kind of vaccine. So it only continues to show us that the vaccines are incredibly safe. And are there some logistical considerations? These two vaccines, because they're messenger RNA, are supposed to be kept at a low temperature, especially the Pfizer vaccine, before they are given to individuals. There is more evidence that's showing that that may not necessarily have to be true, and so it may open up other opportunities for the vaccines not to have to be in a deep freeze where the temperature is kept minus 100 degrees, but in point of fact, can be better used even in regular refrigerators. So we're continuing to learn, again, more and more about the vaccines and how we can store them. So this is a slide that just talks about the vaccine allergy that I was talking to you about. And basically, when we give a vaccine to an individual, we usually observe them for 15 minutes, and just, after that, the person can go home. On the other hand, if a person had a history of severe allergic reaction, again, anaphylaxis, then in consultation with their physician, we would risk assess them, and then we would watch them probably for a half hour to see whether anything like that happened. But the people who have severe allergic reactions to any other vaccine, or people who have allergic reaction to any component of the vaccines, those are the ones that we don't vaccinate at this point in time. So the benefit of vaccination is that, ultimately, when compared to the very severe symptoms a person can develop while ill with COVID-19, and I would, reiterate to you that the public, there are large numbers of people who are asymptomatic carriers of COVID. On the other hand, there are also individuals who get a very mild disease. But if you are hospitalized with COVID, you still have a 8% probability that you will die of the infection. And that's despite all the efforts that we can make in terms of using what's called monoclonal antibody, remdesivir, which is a drug that stops the replication of the virus, because the virus affects every organ of the body, and it becomes very, very problematic. So again, I would simply tell all of you, it's a lot better to get the vaccine than it ever would be to get the disease itself. And the most common side effects are usually a pain or redness at the site of the shot, fatigue, headache, muscle pains, low-grade fever. All this happens within the first 24 to 36 hours after the shot, if you're going to have anything at all. And simply after that, there's no residual. And I would have to tell you that I've had a full 2 doses of the Pfizer vaccine, and I felt perfectly fine both times. So I would tell you that my own personal experience is that it was not anything at all. And as I said, most people experience a very mild or moderate complication of COVID, but there's 10 to 15% of cases progress to severe illness. And as I said, there's of people who are hospitalized, there is an 8% mortality rate, and about 5% of all people who get COVID become critically ill. And there are long-term consequences of COVID. You may have heard of COVID brain or brain fog, where the virus actually affects the ability of people to think and be able to function and all. Extreme fatigue. Many people will complain that even 6 months after having had COVID, their energy level is markedly diminished. And again, there are individuals who suffer heart attacks, stroke, pulmonary embolism, just a variety of other complications that no one wants to have. So it's far, far better to be vaccinated than not. And long-term complications, again, low-risk individuals with COVID, 70% are female, as I was saying, fatigue, muscle aches, shortness of breath, that's dyspnea, and then, as I was mentioning, all the different organs that the COVID can affect. So again, what we have to know is simply that it's far, far better to not get COVID. It's far better to get the vaccine. And the interesting thing I would share with all of you is that just this last week, there was a study done in Israel where the population, 40% of the population in Israel has currently been vaccinated. They are the leaders in the world. And they looked at individuals who had been vaccinated. And what they found was fascinating. They found that after a single dose of the Pfizer vaccine, that 87% of the population who received it were no longer susceptible either to getting an infection, so that there were no asymptomatic carriers in that group, or that the individuals who did become ill were, none of them had to be hospitalized. So the bottom line to it all is that the vaccines are real game changers. And we believe as scientists that somewhere between 70, probably closer to 85% of the population, that when we reach that place where 85% of the population has been vaccinated, then we will have what's called herd immunity, where the virus no longer can replicate itself very easily and will have a tendency to die away and be much less virulent. So the vaccines are safe and effective. As soon as it's available to you, you should get it. The prioritization is set by the state, and according to that tiering system. The side effects are mild compared to anything that COVID could give to you. And as I said before, even after we vaccinate, we're going to continue to wear our masks and do physical distancing, because we have not had real studies, multiple studies, that would demonstrate that you are no longer an asymptomatic carrier, even if you've been vaccinated. However, that most recent study in the last 4 days that was published in the British medical journal Lancet shows that in Israel, they are demonstrating that individuals who've been vaccinated are no longer asymptomatic carriers. And that is really profound. So it may be a real game changer in terms of what we see going on in the next phase of things. So these are just a listing of how many people we have vaccinated so far. Almost 250,000 doses have been given. And the other thing I would tell you that is that there's a wealth of information if you go to houstonmethodist.org/vaccine that you can avail yourself of. in terms of this information. Finally, I'd just like to just make one more plug for the vaccine. The vaccines are lifesavers. The vaccines are the greatest hope and the ability of our society to have been able to go within less than a year to develop a vaccine, test it, trial it, and be able to get it into people's arms is nothing short of unparalleled. And I think that what we have to realize is that we are going to continue to advance medicine all the time. One of the things that people get confused about is that medicine is constantly learning. And so things that people said initially a year ago, as more and more data came to light, then they had to change their opinion. That goes on in medicine all the time. The medical knowledge doubles every 2 years. In the span of a decade, there will be 32 times more knowledge in medicine than there was the previous decade. And that should humble all of us. And we should really recognize that, especially in something that is new and novel, that we have not had experience with, that we need to continue to challenge ourselves and constantly learn. And sometimes the advice that we gave a year ago won't be the same advice that we give today. And a year from now, we may change things around. Like I said, the vaccines seem to be able to go ahead and confer immunity and also destroy the carrier state. If that is indeed proven and shows up, then we will be very quickly advancing to a place where we don't necessarily have to be wearing masks and doing the social distancing. But for currently, we don't have the answer to that. And so while the Israeli study is very exciting, we can't just throw caution to the wind. We have to have other studies that will confirm that indeed that is the case. And that's how science advances. It advances by challenging itself, and it advances by making sure that people are ultimately safe before we change our view of things. So I hope this has been helpful to you. Be happy to answer any questions you might have.
I have a question, actually, Dr. Glass.
Sure.
So first of all, thank you so much for your presentation. It was wonderful. I always like to hear scientific studies and everything. So thank you very much for that. I had a question about the variants. So it is being known that there are several variants out there that originated, at several locations such as South Africa or UK. And I know as a virus, variants are very common because the way they replicate, they are a lot more susceptible to mutation than any other replicative body. But how does the vaccine that is currently developed, the mRNA, stand up against all these variants?
So the answer to that is that there is information that suggests that the vaccines are very effective against all of the variants. On the other hand, it depends on the study that someone looks at, because if you look at just immunoglobulin, if you look at the antibody and its effects against it, even if it turns out that the antibody level that the vaccine produces in your body, instead of neutralizing 95% of the virus, it now neutralizes only 80% of the virus. What's missing in all of that is the functionality of the T cells, those memory cells, those little Pac-Men that I was trying to describe. And so we have to look at all these things in their totality. The other thing is that the vaccines themselves And I think both Moderna has certainly been more speaking to the public than Pfizer has. But Moderna has said if variants become to a place where we think that there is something that the vaccine needs to change, then all we have to do is go in, and within 2 weeks, we can make new vaccines that can change slightly the messenger RNA component. That's what makes these so exciting. These messenger RNA vaccines are really at the cutting edge. And if you remember Ebola a few years ago, that vaccine that was developed for Ebola was also a messenger RNA vaccine. And so we have learned a tremendous amount around all of this. And we've also learned a tremendous amount in terms of our biotechnology industry, because we use these, you may know that we use something called CRISPR, which is like a genetic scissors that we're actually able to go in and actually get just the piece of the variant or the virus that we want to replicate itself without causing, obviously, any harm to the person, because we don't need the whole virus in order to be successful. So these variants, people are looking at them. There's going to be more variants, but the more that we vaccinate people and the faster that the vaccinations occur, it means that the replication rate will continue to diminish. If you look at the TMC data right now, the replication rate here in Greater Houston has fallen. I looked at it last night. It's 0.6. Anything less than 1 means that if an individual was infected with a virus, it would have to, it would only be able to be transmitted to basically a half of another person. So if the replication rate's over 1, which is what we were seeing in December and in January, then the virus was just speeding along. But the fact that the replication rate is low means that the virus has much less of a chance of mutating itself, because it's replicating at a much lower rate than it otherwise was. So all of these signs are very hopeful that we will continue to be a handle on it. But honestly, I would much rather have the public understand the idea that we continue to wear masks, we continue to do social distancing, because all of these measures make a massive positive effect in terms of diminishing the transmissibility of the virus. And the less transmissible it is, the less it mutates. Does that answer your question?
Yes, absolutely. Thank you very much. I do have another question, but I'm not going to hog up all the time. I'm going to let others ask theirs, and then I'll come back again, because I have so many questions and I always hog up all the time.
Okay.
I have a
Anything
question.
I can answer for anyone else?
Yes, Dr. Glass, I have a question. But thank you, Dr. Sonal. Dr. Sonal is a stem cell scientist. She didn't say that, but her background she's got, so no wonder she has so many great questions.
Right.
I have a question. So, well, and a comment. My husband and I both just had our second shot. It was, I had no side effects at all or anything. We had it last Friday, and my husband had minor headache and minor body aches for about 2 hours on his first shot, which was kind of weird. But he has an autoimmune disorder, and he's 65. I was diagnosed with cancer last year. Everything's great. I mean, flying colors. We are so excited that we got in early and got the shot or the vaccine. So we're good with that. But I have a question, and I don't want to scare anybody. I want everybody to get the shot. Please, please go get the vaccine, because we want to protect everybody. I mean, I totally encourage it. But I have a friend, and this is a weird situation, I'm sure. I just wanted to understand a little bit better. She had the vaccine, her and her husband, and I'm thinking it might have been 2 days later, she got really sick and they tested positive for COVID. They were already exposed, were they? Were they already exposed? And then will that one shot help them in the future still? Because I don't think they're going to do the second one. Can you enlighten me?
So the answer
What
to
happened in
that
her situation?
is,
It was so weird.
yeah. So the answer to what you just said is that number one, because as I said, the vaccine is not the virus. It's simply a small protein. It's a small piece of RNA that codes for the spike protein on the surface. And there's actually another one that codes for what's called the N protein also, but we won't go into all that. But the bottom line is that the the fact that they were ill like 2 days later and then they test positive means that they had already been infected, and now their virus load was high enough that they started to get sick. The fact that they got the shot wasn't in their body long enough probably for it to develop any other kind of immunity as such. On the other hand, the fact that they got the shot and, you know, theoretically, maybe 14 days after the initial shot, they could have already started to develop significant amounts of antibody, which may have made their illness with the COVID much less than they otherwise might have been sick with. You understand what I'm saying?
Oh yeah, that makes total sense. Thank you. Your presentation was great. We appreciate it. And I want to mention, I haven't told everybody, but Houston Methodist is a finalist in our Large Business of the Year award. So good luck and congratulations for being a finalist. So
well, great.
Actually,
we are a pretty awesome institution.
You have a great team. You have a great team.
Yeah. Well, I can only tell all of you that having worked for Cleveland Clinic for almost 20 years and all, I am so privileged and honored to work for Houston Methodist because not only is it a world-class organization, every bit at the shoulders of you know, Hopkins or Mayo Clinic or Cleveland Clinic, but in addition, the culture of Houston Methodist is so extraordinary and so based on, you know, stewardship to the community and the I care values that just resonate with it, that it really makes it a really extraordinary organization. So anyway, that's my plug of the morning.
So Dr. Glass, I had a question. So since we're still on phase 1 of the vaccination, and I know people that are in that category that are having trouble even getting the vaccination, should phase 2, 3, and 4 be worried about there not being enough vaccinations, or will they get to everyone? And if they are going to get to them, when will that be? Is it looking, if you're in phase 2 or 3, should you look at maybe the summer, that's when you're going to be called, or?
Well, I think this, I mean, my understanding, and of course I don't have an in with Pfizer and Moderna, but my understanding is that they have been ramping up their production, you know, whether, you know, they were told all along that they needed to have, you know, hundreds of millions of doses. And I think that, you know, this has been something that has been, you know, part of, you know, the entire vaccine distribution piece. I think that, you know, the government has tried to say, okay, well, let's try to get as many people vaccinated with at least one dose, and then, and as such. And there may be some, you know, clinical evidence that may be, you know, partially successful. But I know that for all the things that I've been able to read, that both Moderna and Pfizer are gearing up with, you know, hundreds of millions of doses. So I don't think that, you know, I'm pretty confident that almost everybody in the United States will be able to get vaccinated by late summer for sure. I think that what we've done appropriately is to identify the high risk groups, you know, the people who are in nursing facilities and whatnot, people who are, you know, over 65, people who have, you know, other comorbidities, identify those individuals and get them vaccinated as soon as we can. because, you know, in general, it seems as if, although there was an initial blush of cases with multi-organ failure or something in some children in New York, we haven't seen that as the whole year of 2020 has gone forward. And in point of fact, there are large parts of the population that are at relatively low risk. So getting the high-risk people vaccinated, I think, is a really important piece. And obviously getting everybody vaccinated ultimately, I think, will be another really important piece. The other thing that people don't realize is that we've advanced a lot in our understanding. So whereas before, when the remdesivir or the immunoglobulin, the monoclonal antibody, or the plasma, we used to give that last March and April and May to only the sickest people. Now we've learned that people who are not so sick, early on, if we give the monoclonal antibody or if we give the remdesivir, those are the populations that we can stop from going on to getting so critically ill. So the ability to treat and understand who should be receiving what and at what place in the illness has undergone a dramatic shift. Does that make sense to you?
Yes, thank you.
Yeah, sure.
I have a question.
Yes.
I was wondering if there are any, in the beginning we heard kind of generalizations about people who were almost immune to it and didn't get the disease in the very beginning. I was wondering if there was any more study on why certain populations are not getting it and others are.
So I can't answer that question exactly for you. I mean, that has always been the case with everything in history. So specifically around this, I think that what some people have theorized is that because coronaviruses are part of the human experience in terms of you know, the common cold and whatnot, and all coronaviruses, some people's immune system has the ability to, you know, see COVID-19 as being very similar to, you know, some benign type of, you know, cold virus that somebody got years ago. And so those T cells, those memory cells, get hyped up real fast, and some people just, they don't have any kind of reaction to it and appear to have, you know, just sail right through things. We don't understand all that yet. People are studying it, trying to understand what's going on. But I would only tell you that, and this is just a bit of history, people have looked at, you know, what happened during the plague in the Middle Ages. And they actually exhume genetic material from bodies of people who died during the plague and whatnot. There are certain enclaves of villages in England where there was no plague, and yet the village that was, you know, 3 kilometers away, everybody was dying of plague. And when they look at the genetic material, they came to a startling realization, which is that the people who, because people tended to live in their own little village and marry in the village and whatnot, the bottom line was that when they looked at the genetics, turned out that the people who lived in the villages who did not get sick had a much higher sulfur concentration in their DNA than the people who did not. And so, and the sulfur is a very, very important killer of bacteria. And so the bacteria that causes plague, which is Yersinia pestis, is highly susceptible to sulfur concentrations. So they theorized that maybe this genetic predisposition to having higher sulfur in your DNA actually conferred immunity to those populations. I know that all sounds real weird. I know it sounds like, wow, who does these kind of things? But that's how science tries to advance, by looking at all little bits of information and trying to understand things. And so who knows what we'll find out about the, coronavirus, and why some people get deathly sick from it and other people breeze right through. So
Thank
that
you.
was more than you wanted to know, I'm sure.
No, I've been exposed a couple times to people who had it in very close proximity, and I've not gotten it. And I have a comorbidity, and so I'm always like, well, what the heck's going on here? I should.
Well, we should study you.
Yeah, you should. Many have tried, none have succeeded.
Dr. Glass, I have a question, or I actually have
Yes.
a question that has two parts. The first question is there a relationship between the blood types and the vaccine, or I guess the virus? I've heard through just, numerous conversations here and there that, if you're a type O negative or O positive, or, type A or B, then you are more vulnerable versus another type.
Actually, I think the study was, there was a study that was published that suggested that if you're a type O, that you are less susceptible to getting infected with COVID than if you're another blood type like A, B, or AB. But I don't know enough about that to otherwise comment on it.
Okay, okay. And then the second part was, if somebody gets sick, and, obviously we've all been through these situations where, the exposure and, somebody gets sick and then develop immunity. Do you know on average, or is there a kind of a study done that the immunity would last, an X number of months, and that they should not be worried or should not be in a hurry to go get the vaccine if they have, let's say, my dad he's got the autoimmune disorder, and we are just kind of in that thinking is that if he gets the virus and he's not aligned to get the vaccine just yet, will that line him up to be immune for a certain period of time until the vaccine becomes available to him?
So I have to kind of defer on that because I don't really know the exact aspect of that. I would think, however, that if he has an autoimmune disorder, I'm presuming he's
not over Canada. He's not here.
Pardon me?
He is in Canada. He's not here. And it's just I'm thinking with people that have, because I think my mom they live in the same house, and my mom, I think she's just starting developing some symptoms right now, and I'm thinking if he doesn't get vaccinated, if he gets the virus, God forbid, but if he gets sick and hopefully he recovers, will that kind of give him a little bit of a lead time, I guess, to develop autoimmune or to develop immunity, I guess, from the virus before he gets the vaccine?
So I don't know. There's too many what ifs, I think, to really answer that, completely. So I think that, if you have a concern around him and all, I would get his permission and speak to his physician up in Canada who's caring for him and try to get a better understanding about how they see it. Because they at least would be able to weigh the pros and cons. There's a variety of different autoimmune disorders. In general, autoimmune simply means that you have an antibody floating around that's decided that, your kidney isn't belong to you, it belongs to somebody else. And so now it's going to attack the organ and cause, some kind of inflammatory response. But autoimmune disorders are wide. They go anywhere from just having a circulating antibody to being profoundly making people ill and causing organ failures and whatnot. So I think if I were trying to understand better, I would try to speak to their physician and really get, a better understanding, because otherwise everything would just be speculative, and and then your fear has has the ability to run rampant and all. So, you know, the more information and more knowledge you have, the better you can, you know, understand things, I think.
I think we're lucky, to be honest, being here in the States, despite all the little the hiccups and the hills and valleys that we had to go through at the beginning. I think we stabilized in a bit now with the approach of the vaccine and the availability of the vaccine for a lot of people.
Right.
Looking at things that, like, for example, in Canada being, and I lived there, having, you know, free access to healthcare and all that. They still don't have a clear plan for, you know, executing the vaccine to all these, you know, people. And it kills me because I'm thinking here, we're talking millions have already gotten the vaccine. And there's somebody like my dad who's 70-some years old, who is autoimmune, who's got an autoimmune disorder, and he has not been contacted. He has not been, you know, prioritized or anything of that nature. So there has been a level of, I feel, being here in Houston, that we've really come a long way, to be honest, since last year from where we were, and we were looked at from the rest of the world as, you know, a little bit, you know, the U.S. has been chaotic in dealing with that. But today, where we are, I feel a lot better.
Well, I think that's a very appropriate comment. I have to tell all of you, I've got to kind of run, and I hope you found this interesting and informative, and it was my pleasure to speak to all of you this morning.